Hi and welcome to Cuts Adda. Adda in Hindi, of course, means conversations. And joining us today in our conversation on the International Children's Day is Mr. Luigi D'Aquino, Chief of Health UNICEF India. Welcome, Luigi, to Cuts Adda.
Thank you so much.
Now, coming straight to the big picture, we know COVID-19, the pandemic, has put a great burden on the health system. And as public and private health systems across India are geared up to respond to COVID-19, it actually poses a question on how has this affected illnesses and deaths from preventable diseases, especially in the context of younger children. Luigi, what's your assessment of the situation? And do you think the routine surveillance of diseases like diarrhea, malaria, childhood pneumonia, and other child killers have been hit?
So, very pertinent question. And let me start by saying that disruptions in services have happened across the world. We are experiencing something unique, and therefore, there is no country, probably in the entire world, that has been spared, a bit for children or for adults, by some degree of disruptions to services, which, of course, is not directly due to the disease itself, but primarily and to a large extent by the measures that governments have undertaken to contain the disease, and also by people fears, reactions, and reluctance in the end to access services as they would do earlier. So within this scenario, I think we need to look at your question in a dynamic way. The same question would find different answers at different points in times. We know as a fact that if we look back to the period between March and end of May, we were really globally, as well as in India, dealing with an acute um, response to an unexpected emergency. And therefore, the consequences and what we know from the data as well is that there was indeed a dip. There was an interruption or a disruption in many services. On the other end, if we look at where we are today and hitting the end of November and the end of the year, to a large extent, we are collectively learning to deal with these crises in a more of a chronic condition we have to cope with. And therefore, although in India we don't have public data released after June regarding health information across the nation, we know that the services have largely been recovering, and we know it also from other countries. So you could think of a U-shaped trend where in a certain period of time, services were really went down. And then we have signs and hopes and some evidence that they've gone back again. Again, we need to look at hard facts. And to date, we don't have public data out there for India confirming this. But I think we have strong signs that this has been the case. A couple of other considerations. One is that, talking of India, I'm coming from a country that is probably, you will have spotted from my accent and my name, which is probably as large as Rajasthan alone. So talking of India is a dangerous thing from an epidemiological and or a public health perspective, because we need to look at the diversity of, first of all, the epidemic trend, which is not the same across the country, and also of the health system before and during COVID-19, and also of indicators for reproductive and child health. So we need really to be able to zoom into the various states or union territories, and each story is different. The other consideration, and the very last I want to make, is that we look at COVID-19 as a huge threat across the board. Let us also look at it as a huge opportunity for child health. I'll make 2 or 3 examples to you. The most common word you hear all over, from the news to presidents to schools, online schools, posters on the street, is hand washing. Now, how powerful hand washing is for preventing diarrhea and pneumonia is something we've been promoting for decades. So we have a golden share, thanks to COVID, to use these messages um, to also improve the condition and the update of a critical preventive measure for hand washing. Second example, we hear all over the place patients of COVID need oxygen. And therefore, India is making a huge effort to ramp up its facility capacity to provide oxygen to patients. This is another great opportunity to bank on a COVID-driven investment to make sure that oxygen is available for newborns in need or for children with severe pneumonia. So again, we need to look at the opportunities within the threats. And the very last, infection prevention and control, another big agenda for COVID that will bring big gains for quality of care and again for child health.
Thanks so much. Indeed, interesting points, Luigi, raised by you. And what we also hear these days is a lot of talks about technology and innovations. And again, talking of India's diversity, how many people actually have access to technology? What are your views, Luigi, on how India can cope up better with this adverse situation? And is there an enhanced role of technology you see in healthcare to play in dealing with the situation near future?
Uh, Absolutely, yes, with a caveat. I used to make a maybe inappropriate joke, but talking to the fact that probably there are more apps or new technology creations in India than people. So the caveat is we need to watch scale and not a hugely fragmented environment, which then doesn't bring the change we want to see. With that said, technology has played a huge role and will continue playing a huge role beside, during and after the COVID response. We have examples we have all been learning from. The most immediate one is how we are all been coming together via remote meetings or training sessions. And to the extent to which 9 months down the line, we are all exhausted by it and we want to see people face by face, we also need to recognize that it has been an extremely efficient and effective way to reach at a very affordable cost an amazing number of people with good learning, be it webinars, trainings, or whatever. So this is in our face every day. And I think we have a lessons to learn out of it, not to go back to the full face-to-face standard approaches to capacity strengthening afterwards. Blended trainings and the use of technology would be a good thing. The second very immediate example, which is already out there in India and needs further scaling up, is telemedicine. In a situation where there are barriers on both the demand and the supply side, telemedicine is a huge help to bring capacity and the services that people need, or at least some of them, closer to communities. Of course, the risk of telemedicine, which we cannot lose sight of, is the equity or inequity of the story. So who can access these facilities and who cannot. So the digital divide will take a role. There are other things that technology has brought to us, and we had to learn, and we did it collectively as a community during the COVID response. We have learned to do e-monitoring or e-supervision to healthcare facilities, which maybe without COVID we would have not even remotely considered as an option. And yet we have found ourselves ways to manage to mentor healthcare workers from distance, to manage to supervise a facility from distance. And I think, again, these are massive learnings that we need to take stock of and then bring to scale. The solution is never either black or white. It's not going to be all face-to-face or all remote. I think we have to learn about blended approach. The very last, in a situation where data are really not out there, real-time monitoring, rapid systems for data collection via available technology have really been critical to be able to respond to the needs of people down to the level of communities or health facilities. So indeed, yes, technology is a critical asset as long as we manage it wisely and as long as we remind ourselves collectively that not everybody accesses technology. So there is a risk that the most marginalized are even more marginalized because of the digital divide. If we don't lose sight of that, we have a huge weapon at our disposal, and COVID has taught us big lessons on how to use it.
Thanks so much for the very insightful conversation, Luigi. It was great speaking with you. And I also wish everyone here a very happy International Day. Bye bye and stay safe.
And same for me. Happy International Children's Day, and thank you so much for your time.